Welcome to Section 2 of Cardiac Pharmacology. In this section, we'll be discussing calcium channel blockers. This diagram illustrates the mechanism of many drugs which affect smooth muscle contraction or relaxation. In this video, we will be focusing on the effects of dihydropyridine calcium channel blockers on smooth muscle relaxation. And we can see those dihydropyridine calcium channel blockers over here. And later in the lecture, we'll also be discussing non-dihydropyridine calcium channel blockers. The American Heart Association defines stage 1 hypertension as systolic blood pressure equal to or greater than 130 millimeters of mercury and or a diastolic blood pressure equal to or greater than 80 millimeters of mercury. Medications for stage 1 hypertension are prescribed if the patient has already had a cardiovascular event, such as a heart attack or stroke, or is at high risk of heart attack or stroke based on age. This is where dihydropyridine calcium channel blockers come in. Dihydropyridine calcium channel blockers bind to L-type calcium channels, which you can see shown here, which leads to decreased frequency of these calcium channels opening in response to depolarization. Ultimately, less calcium enters the cell. So we'll draw a down arrow right here. And therefore, calmodulin isn't bound to calcium. So there's less of this active calcium-calmodulin complex, which means there is less stimulation of the myosin light chain kinase, which means less contraction, and ultimately increased relaxation. Now, this smooth muscle relaxation causes peripheral vasodilation, leading to decreased PVR, or peripheral vascular resistance, which then leads to decreased blood pressure and afterload on the heart. It's important to know that dihydropyridine calcium channel blockers are all these dipines, which we've shown right here. And those act primarily on the vascular smooth muscle, whereas non-dihydropyridine calcium channel blockers, such as verapamil and diltiazem, primarily act on the heart. And we'll help you memorize all of these details in our story. So with that background, let's dive in. This story takes place at a beautiful mountain resort that features pools that are fed by natural hot springs. This resort allows very limited occupancy. So when a couple of teenagers try to get in, even though the place is full for the day, they get stopped by the bouncer at the gate. The teenager in the red shirt is pretty upset by this, so he holds up an L on his forehead, suggesting the bouncer is a loser. This same kid is carrying a little crate of fresh milk that he and his friend were going to enjoy while soaking in the hot springs, but those plans were clearly ruined. Calcium-rich milk represents calcium, and this entryway represents calcium channels. So this idea of the L loser hand on the kid trying to get through this channel with the calcium milk should help you remember that calcium channel blockers work by blocking voltage-gated L-type calcium channels. The kid in the yellow tank top tried to make a run for it to get in, but the bouncer, who has a large metal hand, punched him in the chest so hard that his metal fist left prints. The prints caused by the metal fist in this kid's chest will be our symbol for Prinzmetal. And clearly, this teen's chest hurts now, which emphasizes the idea of angina. So this kid getting hit in the chest, leaving behind prints from metal, should help you remember that calcium channel blockers can be used for angina, including Prinzmetal angina, which is also called vasospastic angina. One of the pools at the resort has a little sign outside of it that says dipping pool. This sign will be our symbol for dihydropyridines. And since dipping sounds like dipping, which is the suffix for dihydropyridine calcium channel blockers, then this should help you remember that dihydropyridine calcium channel blockers end with the suffix dipping. For example, amlodipine, nifedipine, clevidipine, nimodipine, and nicardipine. And notice the sign and the pool are located in the green grassy area. This demarcation separates the dihydropyridine or dipping drugs from the non-dihydropyridine drugs, which will be discussed on that side with the brown dirt. So again, dipping pool for dipping. There's a little campfire next to the dipping pool that somebody is using to prepare a meal in a pressure cooker. Remember that pressure cookers are our recurring symbol for hypertension, so this should help you remember that dihydropyridine calcium channel blockers can be used for hypertension. A kid who just finished eating a snow cone can be seen getting ready to dive into the dipping pool. Notice that his fingers are all pale. Holding on to the snow cone while he ate it made his hands pale and cold. And we can also see that he probably got his toes involved in that snow cone, which is why they're all pale and cold and white. In any case, his pale fingertips and toes are the reason why he needs to get into that warm hot spring. Well, these pale, cold fingertips represent Raynaud's syndrome, which can cause decreased blood flow through the fingertips. So this idea should help you remember that dihydropyridine calcium channel blockers can be used for Raynaud's syndrome, or Raynaud's syndrome. That includes both the primary and secondary form of this phenomenon. A pregnant woman who was soaking her feet in the shallow end of the dipping pool just found a knife in the water, and she can be seen carefully removing it with a shocked look on her face. This knife in the dipping pool will be our symbol for nifedipine. And since she's pregnant, This should help you remember that nifedipine is safe in pregnancy. For example, if you're treating a pregnant patient for hypertension, nifedipine is safe to use. Now, the guy who was cooking with the pressure cooker got distracted with his empty box of face cards. He just wanted to play some solitaire, but the box is totally empty. In fact, it's so empty that even a little moth resided in the box, and we can see that moth just floating away. Well, clearly there were no cards in this empty box. No card sounds like the nicard in nicardipine. So no card next to the dipping pool for nicardipine. Distracted with his empty box is what let this pressure cooker get too hot, which has caused several holes to burst open and allow steam to blast out. The dangerously hot pressure cooker represents hypertensive emergency or urgency. So this guy with no cards and the dangerously hot pressure cooker should help you remember that nicardipine can be used in hypertensive emergency or urgency. Before this distracted fellow found that his box of playing cards was empty, he had been washing his cleaver in the dipping pool. The cleaver being washed in the dipping pool will be our symbol for clevidipine. So this should help you remember that clevidipine can also be used in hypertensive emergency or urgency. A musician is standing in some purple and blue spotlights and playing some smooth jazz to help the guests relax. Recall that a smooth jazz player relaxing customers like this under the smooth lights represents vascular smooth muscle relaxation. This should help you remember that dihydropyridine calcium channel blockers act on vascular smooth muscle to cause relaxation. So in other words, the vessels will dilate and there won't be as much pressure in them. Now, a guy in a pink Speedo just climbed out of the pool and apparently had a severe reaction to the natural minerals in the spring water. And we know that because he's got some serious bilateral pedal edema. Poor swollen legs. I guess it's hot spring water. You can't really control what kind of minerals are in it. Well, this should help you remember that dihydropyridine calcium channel blockers can cause peripheral edema. Now, a young boy lost his overly large swimming trunks when he jumped into the pool, and now he can be seen blushing from embarrassment. Well, this blushing kid, with his cheeks all flush red, should help you remember that dihydropyridine calcium channel blockers can cause flushing. An old woman is so shocked by this kid being naked that she jolts backwards and hits her head on a nearby stool, causing her to get super dizzy. Look at those stars of dizziness just spinning around her head. Well, this dizzy old lady should help you remember that dihydropyridine calcium channel blockers can cause dizziness. Another little kid is playing with a Finding Nemo toy in a nearby bush and pretending that it's a coral reef. Nemo sounds like nimodipine, so this should help you remember that nimodipine is another dihydropyridine calcium channel blocker. Now, this kid also has a toy submarine that he has tangled up in a spider web that was in the bush, and he's pretending that Nemo is coming to save the submarine. Well, the submarine represents subarachnoid, and the webs, obviously created by an arachnid, helps reinforce the arachnoid part of the word. So submarine in arachnid webs represents subarachnoid. So this boy, pretending that Nemo has come to save this submarine, should help you remember that nimodipine can treat subarachnoid hemorrhage. It's worth noting that nimodipine is not used for hypertension, angina, or Raynaud phenomenon. It's only used for subarachnoid hemorrhage. To help you remember that, we have this kid totally unrelated to the dipping pool. He isn't in swim clothes, he isn't interested in the pool at all. This should help you mentally remember that this kid just wants to play with his Nemo toy. So again, use nimodipine to treat subarachnoid hemorrhage. An old pervert is trying to get this little kid's attention by shaking a piece of licorice around his head. Recall that red licorice represents blood vessels, and the shaking red licorice represents vasospasm. And the flustered old man is hitting his head and shaking his head with the licorice, just so frustrated, which emphasizes specifically cerebral vasospasm. Thankfully, this Nemo-obsessed boy is totally uninterested in candy at the moment. So, ignoring this spazzing licorice represents preventing cerebral vasospasm. So these ideas together should help you remember why nimodipine is so useful for subarachnoid hemorrhage. It's because it prevents cerebral vasospasm. Now let's discuss the non-dihydropyridine drugs, over here in the brown dirt area. It was recently discovered that there are dinosaur fossils under that round pool, so the spring water has been temporarily diverted for excavation purposes. And we see a sign outside of it that says no dipping. So this will be our symbol for non-dihydropyridine calcium channel blockers. There's currently a velociraptor fossil being excavated, and there's a sign down near the site that says Velociraptor excavation in progress. Well, velociraptor sounds like verapamil, so this should help you remember that verapamil is a non-dihydropyridine calcium channel blocker. The chief archaeologist on site is taking a break and enjoying a jar of dill pickles while he surveys the project. Dil is our symbol for diltiazem, so this should help you remember that diltiazem is another non-dihydropyridine calcium channel blocker. It is worth noting that diltiazem has both dihydropyridine and non-dihydropyridine properties, although it's technically non-dihydropyridine in structure. It's also worth noting that diltiazem can theoretically be used to treat hypertension, just like the dihydropyridine calcium channel blockers that we represented over on the green grass with a pressure cooker. However, in real practice, diltiazem is almost never used for hypertension. So, with that all being said, if you can just remember that diltiazem is a non-dihydropyridine calcium channel blocker, you're golden. Now let's talk about the uses of these non-dihydropyridine calcium channel blockers, including verapamil and diltiazem. There's a no parking sign near this no dipping pool that some punk has parked his car right in front of. See that red car back there? Comes right up and gets out and then starts scribbling all over this no parking sign. If you notice, the pattern of his vandalism looks a lot like an AFib reading on an ECG. AFib on an ECG reading has no P waves, and that's one of the quickest ways to recognize AFib on an ECG. So, no parking represents no P waves to help you remember atrial fibrillation. And oftentimes, we group up AFib and atrial flutter. And in this case, that's what we've done, even though they're two distinct entities. So the whole idea here is to help you remember that diltiazem and verapamil can be used for atrial fibrillation or atrial flutter. Somebody was walking by the Velociraptor excavation site and accidentally dropped a bunch of peanut cluster candy down onto the fossil. Look at those peanut clusters. Well, one of the archaeologists saw what happened and was so mad that he hit the guy right in the face and is now looking down on the fossil and crying. You can see that tear coming out of the archaeologist's eye. Well, peanut clusters represent cluster, as in cluster headache. And notice that only one side of this guy's face is throbbing in pain. This is to help you remember that cluster headaches typically cause unilateral pain. And the distraught archaeologist crying represents the unilateral tearing that can occur with cluster headaches. So this whole ordeal around the Velociraptor excavation should help you remember that verapamil can be used as prophylaxis in cluster headaches. And those symptoms include unilateral tearing, redness, and pain on one side of the face. Now let's discuss the side effects of verapamil. Another archaeologist is down in the pit displaying a rendering of what the Velociraptor might have looked like, and he is focusing on its impressive teeth and prominent gums. The prominent gums on this Velociraptor should help you remember that verapamil can cause gingival hyperplasia. You can remember that this adverse effect only applies to verapamil, not diltiazem, because it's the Velociraptor that has the prominent gums. Now let's discuss some adverse effects that apply to both verapamil and diltiazem, which will be located over here on this side of the excavation site. Somebody is just rolling in on an ATV after a long day of riding, but something is clearly wrong with the ATV, because although this guy is twisting the throttle, it's barely putting along. ATV represents atrioventricular, and the broken engine emphasizes atrioventricular or AV block. So this should help you remember that verapamil and diltiazem can cause cardiac depression or AV block. An obnoxious young boy nearby got his hands on some balloons, so he decided to stuff them under his shirt to make it look like he has breasts. Boys are super immature sometimes. But anyways, this immature little boy should help you remember that verapamil and diltiazem can cause gynecomastia. To take the shenanigans to the next level, this ridiculous kid decided to pour milk all over his fake breasts. This juvenile display should help you remember that verapamil and diltiazem can cause hyperprolactinemia, which can cause things like galactorrhea. Somebody can be seen in the porta potty trying to relieve himself, but unfortunately, he is super constipated, and he's so distressed that he doesn't seem to mind at all that the door is gaping open for everyone to see him. This constipated fellow should help you remember that verapamil and diltiazem can cause constipation. And that concludes this section.